Good afternoon, everyone. My name is Brendan Cosette. I am the Chief Operating Officer of the Missouri Chamber of Commerce and Industry here in Jefferson City, and I'd like to welcome you to our Child Care Funding webinar. We all know child care is an incredibly important issue, not only for folks like myself who have young children in child care. I pray, by the way, that my son is napping at the moment, but also from an economic standpoint. There are over 10 million jobs in this country right now that are unfilled. And just think how many of those could be filled if there was more affordable and available childcare across the state and across the country. Human capital is incredibly important to economic growth, and not having these folks in the workforce stunts economic growth. So it's an issue that affects us all in one way or another. And I can't believe I'm saying this, but thankfully there is some government intervention that we've seen over the past couple of years in the state of Missouri. And we have two statewide leaders who are responsible for a lot of the good things that the state is doing to alleviate some of our child care issues today, with Representative Betsy Fogle and Dr. Pat Thomas from the Office of Child Care for the state. We'll hear from both of them, and then hopefully at the end we'll have time for some questions and answers. So if you have a question, please go ahead and type it into the chat room, and we'll get to it after Dr. Thomas's presentation is over with. So we'll begin with Representative Betsy Fogle, who represents the northeast area of Springfield and is in her first term and serves on the House Appropriations Committee. She was a 2022 Champion of Missouri Business awardee from the Chamber and has done a bang-up job in working on child care issues, and she'll speak of some of the things that she was instrumental in getting done this year. And we really look forward to working with her on this and other issues as her legislative career continues. So Representative Fogle, please take it away.
Thank you so much. Hey, everybody. I'm State Representative Betsy Fogle. I serve House District 135 here in the state of Missouri, which, if you are familiar with Springfield, is the northeast quadrant of our great city. I got involved in this child care discussion after knocking doors in my community. I started knocking doors. I'm back on the ballot November 8th and started knocking doors last December, and started hearing from families when I was out knocking doors that they were having such a issue finding affordable and quality childcare services. I, of course, knocked doors back in 2020 during the kind of the beginning and middle of the COVID pandemic, and not a concern I heard from constituents. But fast forward 2 years and going into 2022, very much the number one issue that I heard from families. And it was families of all kinds, families that were struggling with poverty and wanted to enter into the workforce for maybe the first time, and a physician who moved to Springfield and has quite a bit of money in her bank account, but wasn't able to find anywhere to put her 3 triplets because no childcare facilities had spots. So it was definitely impacting constituents of all walks of life, and something that I really wanted to focus on. Something that I want to celebrate is, I think this was a really great example of how people can work across the aisle to move our state forward. I had the pleasure of working on this child care funding that Dr. Thomas will get into a little bit more specifically later on, but we were able to get $20 million of child care infrastructure in the state budget for small businesses and essential workers. We did that alongside Senator Lincoln Huff's office, who is a state senator from here in Springfield. And again, I think what we saw as it relates to childcare is this is a problem that affects everybody. It affects families of all different types, of all political ideologies. And this was a really great opportunity for us to build that bridge across the aisle and do something great for our state, knowing that it was impacting everybody. On the House side, I serve on the House Appropriations Committee. We mentioned that a little bit earlier. I worked alongside Representative and Chairman Cody Smith, who is our budget chair in the House, who's very supportive of this funding, knowing that we had an opportunity to really transform lives of individuals that live all over the state in, urban areas and rural areas, everywhere suffering from a lack of childcare. And of course, the Missouri Chamber spent lots of hours in my office figuring out how do we best utilize these funds, how do we work this language so it maximizes the needs that all families have. A little bit before this panel discussion, Dr. Thomas and I were talking about how childcare can't look like one thing because needs are so drastic depending where you live, depending on the needs of your family. So we were able to do something that I very much hope benefits all of you that are listening, all of our small businesses, all of our essential workforce, knowing that we want an economy that works for everybody, and we can't have that if individuals can't enter into the workforce. A shocking statistic that I remember the Missouri Chamber sharing with all the legislators is that last year, our economy lost out on $1.35 billion because families weren't able to enter into the workforce. And that is a very shocking statistic, and something that we know is not good for our economy, not good for our families, not good for our children when they don't have a safe place to go during the day so parents and guardians can enter into the workforce. Thank you all so much for being here. Thank you for wading into these waters with us. There's a lot we're still figuring out, and I know Dr. Thomas is going to do an incredible job of walking us through this funding, how to apply for it, how to benefit from it. But childcare and the lack of childcare access is a very complex problem, and I couldn't be happier and more proud to be a part of the team trying to figure out solutions for not only Springfield, but the rest of Missouri. So thank you guys so much for being here, and I look forward to the presentation.
Thank you, Representative Fogle. And we're fortunate to have Representative Fogle and others who are advocating for this funding and other positive direction of childcare issues in the legislature. And that reminds me to please, we have people all over the state on this webinar, please don't hesitate to talk to your legislators about these issues and call them and ask them what they're doing to try to help out. It really makes a difference when it comes from people on the ground at home as opposed to the lobbyists and folks like myself. So, but we're very fortunate to have Representative Fogle and others like her working in this area and doing some really good things. So now we'll move on to Dr. Pam Thomas, excuse me. Dr. Thomas is director of the Office of Childhood. In this role, Dr. Thomas is charged with the oversight of our early childhood education programs. She has the unique distinction of being the first director of the Office of Childhood, which is recently created by Governor Mike Parson and is housed within the Department of Elementary and Secondary Education. We've been fortunate to work with Dr. Thomas on a number of issues. She's been a great asset to the chamber and for everybody who's interested in the childcare community. And we appreciate her business-friendly approach and drive for an innovation, expanding access to early childhood education and care. So, Dr. Thomas.
Thank you so much, Brendan, for that great introduction. Welcome, everyone. I'm excited to be here today to talk about some childcare funding opportunities that are in place now and also coming up soon. So if you can advance the slide, we'll look at the agenda for today. All right. What we're going to talk about today is just a quick look at the Office of Childhood and an overview of those applications that are in place today. Those are just some background information for some of you that might need that. Most of our time is going to be spent on information about the new grants that were mentioned. These are coming up soon, including startup for childcare programs. And of course, we will reserve some time for questions and answers with you. Okay, so like Brendan just mentioned, our Office of Childhood, many of you are aware, was created last year with an executive order from Governor Parson that really aimed to move nearly all of our early childhood programs and after school programs that are administered by state agencies into one office. The purpose of that was to consolidate our operations and really have one mission for childhood programs. We moved nearly 150 employees from Social Services, Department of Health and Senior Services, and the Department of Elementary and Secondary Education into one office. And this has helped us provide a more comprehensive approach to the various services you can see listed here that are the childhood programs in the state. So keep in mind, we are just 1 year into our office and we haven't quite figured out everything yet, but we are certainly more connected and more coordinated than we were prior to this one office, especially in the areas of stakeholder engagement and communications with the public. One of the biggest challenges that we have in the Office of Childhood is really how to respond to the pandemic. And this has created a crisis level for many of our childhood programs, but especially for childcare. Couple of things for you to know, I think that's important to set the stage for why we're talking about the need for childcare. Just a few months into the pandemic, our childcare programs were closing due to lack of staff or parents not able to take their children to childcare. Compared to before the pandemic, we had childcare facilities reducing overall by 32%. The number of programs accepting subsidy payments decreased nearly 35%, and the number of children receiving state subsidy decreased nearly 36%. So in general, what we saw was a 1 in 3 reduction in facilities and a 1 in 3 reduction in the number of children being served. So more than any other childhood program in our office, child care has not rebounded from these challenges that we saw in the pandemic. If you could go back a slide, please. Thank you. I also wanted to mention here that it's not just Missouri. All states across the U.S. are facing the child care challenges that we're going to talk about today. So our call to action in Missouri is to figure out how to build our infrastructure back for child care. And I really see this opportunity of this pandemic as an opportunity for us to rethink our work and really rebuild that infrastructure of child care. Okay, next slide, please. Okay, so how do we do this? We have some grant opportunities through federal child care relief funds that have come to our state, and we are working on a two-prong approach to strengthening the child care system. It's really about workforce and it's about access. So for workforce, we need to recruit more providers into the child care industry. We also need to build the capacity of existing child care providers if we're going to retain them. In this past couple of months, I've talked to a lot of child care providers that have said, even if we start up a new child care program, we may not have the staff to be able to have all of our classrooms open. So it's not just starting new ones, it's also figuring out how we retain that workforce. For access, it's about finding entities that want to start up childcare to help support their employees, whether that's essential workers or small businesses. So it's expanding existing programs that want to serve children, but also really looking at the rural areas where we have little or no options for childcare. So our goal in doing this is to really accomplish benefit to the overall workforce, not just increasing the number of people that are working in childcare, but also mothers and fathers can enter the workforce, just like Representative Fogle was saying. When they know that their children are in safe, quality programs, they can focus on their work and they're not distracted or concerned about where their children are going to go. The other thing that we can also expect as a benefit is really access to childcare that helps promote the children's growth and development. So getting children ready for school, getting children in an environment they're growing and learning, and that creates a win-win for all of us. Okay, next slide, please. Just want to briefly mention that we have 3 grants that are open right now to help support childcare workforce. And there's a saying that says that childcare is the workforce behind the workforce, and that is so true. These applications are intended to help recruit and retain childcare workers. They're all open right now until November 30th at 11:59 p.m. We've already had hundreds of programs apply for them. So just want to get the word out that these are available, and to be eligible for these particular funds, the providers are required to be licensed and have all the health and safety training requirements, or they are enrolled in the state subsidy program. So if your child care program, or you know someone that has a child care program that meets that requirement, just want to make sure that they are aware that these are open. They are able to look into the details to see if they would like to apply. We will likely have 2 more rounds, if not 3 more rounds of these funds in 2023 and 24. So it won't just be this opportunity. There will be future opportunities for these funds as well. Okay, next slide. Here's really where I want to start taking some time to talk about what's coming up. So we wanted to give you a heads up that we are actively working on a startup application for new child care programs who want to support children of essential workers. Essential workers are defined as state of Missouri employees healthcare employees, such as those working in a hospital, long-term care facility, or a medical clinic. Emergency responders, such as those working in law enforcement, firefighters, or emergency medical technicians, or EMT. And this application is going to be available to new child care programs who aim to serve at least 25% of their total overall capacity for children of essential workers that are in their community. So the application is going to be looking at certain areas of the state that are rural communities. We're wanting to make sure that those applications are in counties that have state facilities, have hospitals, correctional facilities, long-term care facilities, so that we can make sure that we're able to support the new child care programs in serving essential workers. Just a couple more notes here about this application. There will be increased funds if that program wants to serve not only the traditional day hours, but also wants to serve the non-traditional hours, which is evenings and weekends on Saturday or Sunday. We really are targeting those increased funds because many of our essential workers that I just mentioned work several shifts. It's not just a 9-to-5 job, and we want to help support that need for extended care into the evening or on the weekends. And then I also wanted to mention, we are on track to release this application next week. So watch for an announcement. This will go out to our various stakeholder groups, as well as our partners at other state agencies. And hopefully the Missouri Chamber will be helping us share this information. We'll be getting that out. Our plan is on Tuesday sometime, November 1 is when that application is planned to be released. We'll have terms and conditions and instructions and other parts of information to help support those that are interested in this grant. Okay, next slide, please. Our other startup program that we wanted to mention is specifically for small businesses, and this will be coming in early November, either next week or the following week of November 7th. This will be released, and this is specific for small businesses that are defined as an entity with fewer than 500 employees working for them. So the application will be available to serve new child care programs who aim to serve at least 25% of their total capacity, helping children who are of small businesses. The application is targeted to areas of the state that had no applications in our 2021-22 round, or they had very few recipients of the first round of startup application funds last year. So we want to make sure that we're really getting to those greatest areas of need that do not have any child care programs or very few child care programs in those communities. This application will require a letter of support from at least one small business in that community that explains the need and how they're going to help support the child care program in serving children of small business. This application will also require a short description of how the program is going to support that local community and the small businesses in. So again, watch for some more information that will either be coming up next week or the following week. And we do aim to have this application out early November and messaged throughout those same channels of communications. Okay, next slide, please. So I just wanted to also plant the seed here that we wanted to let you know that we are planning for innovation grants next year. We're still working on the design of this program, so I don't have a lot of detail, but that's one of the great opportunities of speaking to stakeholders like yourself as we're in the design stage, because we would be able to help weave in some comments and some suggestions and ideas on how to utilize innovation grants. What we have right now is in our approved spend plan. You can see the link to that here at the bottom of your page. We do have some guidance that's been approved, and that is going to help us guide how the grants are developed. And I'll just kind of briefly highlight that. We do know that the innovation grants are intended to increase the availability of quality childcare in the communities and support the workforce overall. We do know that there will be an opportunity for businesses of all sizes, small and large, to be able to establish on-site childcare or childcare that's nearby their workplace. It can include entities such as hospitals, schools, long-term care, for-profit businesses, nonprofit businesses. There really isn't a limit to the type of business entity that can be wanting to promote childcare. We also know that it will have some sort of a partnership between the business and the childcare program, but that could look a little different in what's proposed. It could be contracted, or it could be employees. It really just depends on what the business in that community wants to propose. It also allows for existing childcare programs to expand or to partner with a business to serve additional children of their employees. The innovation grants will require the business or community programs to have some type of matched or in-kind contribution funds. So that would be where one entity is providing a certain amount, and then the child care program gets another certain amount to match that. This application process does require some type of a sustainability plan as part of the application to ensure that the startup funds or expansion funds will be used in a long-term vision for that community. The estimated number of programs is really that are going to be awarded is really dependent upon the size of the programs being proposed. As you know, the larger the program, the more costs that are associated with it. And it also depends on the needs of the communities that are applying and how many communities apply. We do aim to have these as flexible as possible. Like Representative Fogle mentioned, there's a lot of diversity in the needs of families, a lot of diversity in the needs of communities. So we want to really try to provide some flexibility that will allow child care programs to receive funding in the way that best meets the needs of the businesses and the communities. We will have more information about these grants coming out in January, but I just wanted to get the word out today. If you're interested or have some more comments or suggestions, we're open to those, but also to let you know that if you're not eligible for the 2 grants that I mentioned that are coming up in November, or you might not be eligible for them, that there is other opportunities that are coming for businesses and childcare partnerships. I think I'm going to stop there. You can go ahead and advance the slide to our questions and answers. I think I'm going to just stop there and turn it back over to see if we've got some questions that have come in and allow some opportunity for comments if applicable. Brendan, I think it goes back to you.
It does. Thank you, Dr. Thomas. We appreciate that. I know there's definitely going to be a lot of interest in more information on those grants, and we're happy to disseminate all the information out through our network as it becomes available. Had a couple questions specifically. One was related to the difficulty that some facilities can have in getting employees licensed in a timely manner. And I know that part of what your office is working on and a number of other entities is trying to eliminate as many regulatory hurdles as possible. Can you talk a little bit about those and what efforts are being made in that front?
Yeah, that's a great question. And it is a common question that we get. So I'll kind of answer this in 2 different ways. One, talking about some of the tips and tricks that can help with that process. And number 2, talking about our initiative that we have with the Lieutenant Governor's Office in Reimagining Childcare. So first, I'll talk about some of the tips and tricks, so to speak, that we are weaving into our new application. So the licensing process is not always quick and easy. And we do know that, and we're trying to help improve that process. But I think that is a shared responsibility between the provider and our state office. So a couple of things that businesses or new childcare programs can be thinking about is the space, the facility size. and really maybe having someone come out and take a look at that space before deciding that's where you would like to have the child care center. One of the things that's really important to remember is you have to have certain amount of space for each child that you're going to be able to care for in that facility. So sometimes programs think they're going to be able to fit 30 children in a space, but when we come out to measure it, there's only going to be able to have maybe 20 children in that space. So making sure that first and foremost, you're aware of the facility requirements in order for you to have enough space to license. And that depends upon the age of your child, that you're the age of the children that you're going to serve. So if you're thinking about a certain space, call our local licensing office. They can always set up an initial physical visit with you to kind of walk through that and just see if that's going to be a reasonable space. You can also have your fire marshal office inspector come out and take a look to see if that's something that's going to be able to be repurposed for childcare. So I think first and foremost, think about that space. That is something, Brendan, that has slowed down the licensing process. And most of the time, that is the one thing that creates the biggest hurdle. But we can do this upfront before you're even applying for a license. We can get out there and provide some technical assistance. Keep in mind, it's not only our office, it's the Department of Public Safety with the Fire Marshal's office, as well as at the Department of Health and Senior Services. They do the sanitation inspections as well. So we share that with the two agencies. I do want to mention real quickly, we get a lot of questions of what are we doing in our new office to try to make that process simpler. We don't want to necessarily remove rules that keep kids safe. We know families want to feel that their children are safe and know that they have that. So we have to be careful about making sure we're still holding that as a standard. But there's a lot of things that we're looking at right now through that Reimagining Childcare initiative. We've retrained all of our staff on customer service and really thinking about us as being helpers and coaches and teachers for childcare providers and helping to support them through that process, and not feel like we're just trying to focus on compliance, but we're trying to help them understand what they can do to have a real quality program. The other thing besides customer service that we're focusing on is really the procedures. So once the rules are in place, what are the procedures that we use to implement those rules? And one of the things that I've heard in this first year in the office is childcare providers sometimes say it feels like a fire hydrant, like everything all at once, all the time with the rule process. And so we're looking at ways to provide some differential monitoring and differential rule implementation where it's not necessarily everything all at once, all the time. But let's take a look at what's really critical to start with, and then what can we come back and support later. So kind of phasing that in a little bit more instead of everything all at once. So those are probably the two biggest initiatives that we've already taken on and starting to help make that process a little smoother.
One of the specific questions relating to licensure is regarding getting employees licensed or making sure that it's okay to bring them to work. So apparently the process sometimes can take long enough where some folks are deciding to pursue other employment while they wait. Is that something that you have the ability to do much about, or is that under one of those other agencies' authority?
Yeah, that's another great question. So in addition to the facility question that we just talked about, the second arm of that is the workforce. So we do require to have new staff fingerprinted. They have to pass the background check and the safety check. So there are some things that they have to do, as well as there's some required training like safe sleep for some programs that need to be in place before they are able to care directly for children on their own. Again, that's really a big safety piece to make sure that our child care staff members have been past those pieces. So the fingerprinting checks come through the Department of Public Safety through the Highway Patrol. And then we receive that and issue an eligibility letter for that staff member. And then our safety registries come through the Department of Health and Senior Services in that program. And so we receive that information as well. I'm really proud of our team and our office because as soon as they receive those informations, our tracking of that time frame has been 1 to 3 days. We turn that around. I think sometimes there can be some processes that are slowed down in the other agencies as well. And we work with them. We're working right now with the Department of Health and Senior Services to try to figure out how to get those safety registry checks through as quickly as we can so we can issue those. I think, Brendan, that's a challenge, honestly, that all of us in the workforce face right now. If you're working directly with students and children or the elderly in long-term facilities, you know, we interview great staff. We're excited to have the opportunity to have them work for us. And sometimes we can't get them hired on before they find something else. So we certainly understand that stressor in the workforce.
Well, I can tell you that there are very few industries that aren't dealing with trying to get employees and dealing with the competitiveness of everything else is out there because everybody's hiring.
Absolutely. We are all facing that.
Yeah. Switching gears slightly, had a couple questions about how much funding is available for the innovation grants and how long, putting you on the spot here, how long do you anticipate it taking to get those funds out?
Yeah, great question. So actually you're causing me to pull up our spin plan real quick here so I can make sure that I say this correctly. So in the link that I had shared that has the discretionary spin plan is where you will find these new grants that I mentioned. And just to clarify, that's different than the grants that are out there right now. So there's 2 different spin plans and you'll see those on the links on the page. So I want to clarify that. At the top of the spin plan, you'll see the liquidation date. The startup grant spin plan is to be liquidated in September of 2024. So that means we're going to have several rounds of startup grants and several rounds of expansion or innovation grants. So again, like I had shared with the audience earlier, don't feel like this is the only opportunity that you're going to have. We're going to have several rounds of those as we keep continuing to issue funds in areas that are the most of need, according to our data that we have. So for our current startup grants for our essential workers and small businesses that will be coming out, there will be 90 days to apply. So those will end at January 31st. We will review, award, and determine how much money is left over after that. Right now in our spend plan, we have $60 million allocated. I'm sorry, wrong line, $20 million, like Representative Fogle mentioned, $20 million allocated to these first 2 grants. And then once we get those in and when they are awarded, we'll assess how much money is left. We'll take another look at the state and see where are the areas of most need for those essential workers or small businesses, and then we'll put out another round. We don't expect to spend all of the money in the first round. If we do, that's fantastic, but we expect we'll have another round of those. Then I'm sorry, I spoke too soon. The $60 million is tied to the innovation grants. We do expect to put those out early next year. And the same thing, probably 90, 120 days to apply, get the word out there, have them fill out the applications. We'll do the awards. We'll reassess how much money is left and in what areas of the state. And we do expect to have those as well. I didn't mention this, but if you're looking at the spend plan, you'll notice that we have several activities in here for starting up and expanding other things as well. For example, specifically starting up and expanding for those who want to serve infant and toddlers. It's a huge need right now. We hear it everywhere we go. We might have services for preschoolers and after school programs, but we don't have anybody who's going to care for infants and toddlers. So we will specifically have that, or children with special needs. You'll also see in here that we have enhancements, which is upgrades for childcare programs. So they'll be able to come back and help support some of those types of activities for our childcare programs in the next 2 years.
By the way, I've had a lot of questions, and I assume this is okay because we are recording this, and we're going to send it back out. We're going to edit it, and it'll be sent back out next week sometime. So it can be disseminated far and wide, but I assume you're okay with sharing your slides.
Sure, absolutely.
Okay. Thank you. Another question, and this is the $64,000 question from one of our attendees who says, I've heard talk about the paradox of low pay for childcare workers, yet the high cost of childcare for parents. Some say the model is broken. How do we address that? Now, I know that's a very difficult question, and there is no silver bullet, but still love to hear you have your thoughts on that.
Yeah, Brendan, thanks. And I might elevate that to be a $64 million question instead of a $64,000 question. So to be honest with you, we were on the path of this paradox well before the pandemic, and the pandemic has just really magnified the situation. And I like to use this visual of we are at a place right now where parents are paying as much as they can pay, and providers can't charge any less for their programs. And what we end up with is this gap in the middle. In order to close that gap, to have quality care for children, providers can't really charge any less, and families can't afford any more. And what we have to do is figure out how to pay for that gap. And for our state, we set the rates for the subsidy program, which is for children of families in poverty. But this gap exists for all of our families. So I don't know that our office is going to be able to figure out that gap by ourselves. It's going to take all of us figuring out some sort of a mixed approach to how we deal with that, because for like Representative Fogle mentioned, we were talking earlier that the needs of families is so different, and the needs of the child care programs are so different. So how do we create a system that meets everyone's needs, and how do we do that when we're starting that infrastructure with a gap? So I don't have answers to that. I do know that there is no a silver bullet, as you mentioned. There's no one answer. It's multifaceted, and it's big, and it's complex. And so we are going to have to start, that saying, how do you eat an elephant one bite at a time? And these relief funds are our attempt to start looking at taking that bite, one small bite at a time. In addition to our Reimagining Childcare initiative, we have a team that's working on a study for our subsidy rate structure. And so that study will be happening over the next 6 to 9 months, and really getting down deep into the core challenges that we have with that structure, because that is a piece of that we have to do from our office perspective. But we're going to have schools, businesses, we're going to have others help us figure that out, because some of the families that we are serving in the licensing perspective, we don't set the rates. And that's a myth, I think, sometimes, that folks think our office sets the rates for childcare across the state. We set the rates for the subsidy program, but we don't set the rates otherwise. We're going to have to figure out how to close that gap.
A couple questions have come in back to the licensing, and I completely understand the difficulty. Is there's 3 different agencies working on that, and also, not that I am in any position to speak for the governor, but or you for that matter, but I think part of why the governor created the Department of Childcare Childhood, is to try to help make things a little bit more efficient. And have you looked at, or is it in the plans, as you're aware, of trying to keep everything under one roof as opposed to going through DHSS and DPS, et cetera? Or is that possible?
We had those conversations early on when we were talking about the Office of Childhood and kind of what goes into the office, what does not go into the office. There are some pieces that we still connect with that did not come into the office. And I'll just kind of use the example of the fingerprinting. Our Department of Elementary and Secondary Education's likely never going to do fingerprinting. I mean, that is through the Department of Public Safety with the Highway Patrol, and they really established that. So all of our 500 plus school districts use the Highway Patrol system for fingerprinting. So I don't think that was ever will ever be a conversation, because that is in the wheelhouse of public safety and for all customers, not just childcare. The other kind of becomes the fire inspection and the sanitation inspection. And for those of you that are involved in that in a business like a restaurant, even outside of childcare, there's a lot of requirements and regulations, and they not only do those inspections for childcare, they do them for all businesses, long-term care, hospitals, restaurants. And so in that sense, there are always going to be partners with childcare because they are a business and because they're serving children that will not be in the office. I don't think there was an expectation for absolutely everything that touches the program to come into the office. We don't see that with school districts, and we won't see that with childcare businesses as well.
Okay. One more on that line. What about digital records and record keeping? Is that something that you'll have looked at?
We are not only looking at it, Brendan, we are in the throes of it. So if you're looking at stabilization and discretionary in both of the spend plans, you will see a line for one integrated single online childcare system to move all of those records into a single system. And so as an example, right now, I think we have no less than 10 systems involved in the process of becoming licensed or contracted for subsidy. And it's very disparate and it's very old. And a lot of the things that we do are manual when they need to be automated. And it needs to be where families, providers, and our staff can all see the same thing at the same time. So we are in the process right now of putting out bids. We're going to be reviewing them. We're going to be awarding them. Our goal has always been in 2023 to put in place a new integrated child care system that is more cloud service based, more automated, and based on the login, you can see information near real time. So I think that is something that slows down a lot of the processes because of some of those disparate systems. And, a year from now, we hopefully are talking about how those timeframes have greatly increased in the efficiency, because you're not waiting for people in 3 different places to key something in. It's automatically in there.
Okay, great. Thank you. I know there's a lot of people who'll be pleased to hear that. Back to the grants. Can the grants be stacked?
So I'm going to answer that and how I'm interpreting it. I think what you're saying, Brendan, is can I apply for more than one startup and I can stack my grants in that way, maybe? In order to apply for one of the grants, you'll have to obtain what's called the department vendor number or DVN number, the client number, and only one number can apply for a startup grant. So if you applied for a startup grant last year, you're already an established child care program. You can't start up a program when you're already a child care program. So you can only start up one time. And then after you've started up and you've established yourself as a child care program, you'll want to look for all of our other opportunities for existing child care programs to receive some of those retention grants that I mentioned, to receive some of the upgrades and enhancement grants that are coming. So I think if I'm answering that correctly, it would be no, you can't stack them in one program because you can only start up a program once.
Okay. And then another question in relation to the innovation grants, will they go beyond the 0 through 6 and include school age kids?
Yes.
Okay, cool. We have a question from one of our colleagues at the Springfield Chamber of Commerce.
Brandon, before you go on,
yeah,
to clarify, all licensed all of the child care programs can do birth through school age right now. So even the startup grants that we're talking about right now, if the employees are needing after school care, that could be something that could be done in partnership with that child care program. So I don't believe that we've put a limit on the ages currently, just because the licensing process allows for both preschool as well as after school.
Okay. So question from our colleagues at the Springfield Chamber. Are there any, which I want to know this too, and hopefully we at the State Chamber can be helpful. are there any specific legislative proposals or budget requests that you all are going to bring forward during the 2023 legislative session?
Yeah, there's been some conversations about those. I have not seen anything finalized at this time. I know we have some of our advocacy partners, as well as some of our policymakers that have been talking about some of those. So I know that's going around. I haven't seen something on paper or finalized at this time.
Okay. Well, obviously, whatever means you have to spread that out, and we're happy to help as well. And I'm sure most of the people on this call that, as I mentioned earlier, advocacy is in working on this issue kind of falls to all of us, and we need to all be talking to our legislators and policymakers and discussing how important this is. So one more question, at least right now, if I was awarded for an expansion grant, can I get under a new DV in? It's cut off on my screen. And I'm not very adept at manipulating this technology. Can I apply for a startup grant?
Yeah, so the answer is yes. We have several current childcare programs where the owner would like to start a new facility. And so as long as the startup grant is defined as that particular program, that facility, that location, is not licensed when you apply, then you would be able to apply for a startup. So yeah, we do anticipate some of our current childcare programs wanting to start up a new program to add to their business.
Okay. All right. I am trying to see what other questions we may have. Is there anything, while I'm trying to do this, is there anything else you'd like to elaborate on?
The only thing I will mention, if I can have just a second, is a couple of weeks ago, we had a great group of stakeholders come together to represent some of our small businesses, our nonprofit organizations, and some of our childcare programs. And we really talked about what the needs are, what some of the ideas and strategies are for strengthening childcare. So there's about 30 of us in the room, I believe. And it was just a great conversation. And what it showed me is that we have not brought together the childcare and the business community. It took a pandemic. It took a pandemic for us to realize these two entities are connected. These two entities are, we have to work together. Like I just said earlier, that saying that childcare is the workforce behind the workforce. And I don't think we do a great job making those connections. And, businesses are experts in that field, and childcare providers are experts in knowing what children and families need for that care and education. And just would encourage all of you that are attending today to think about how at your local community level, you can make those connections with the child care providers in your community. So I think that's important. And another thing, we put out a survey in partnership with the Department of Economic Development. We've been working really closely with them for the last 2 to 3 months specifically on some of these business child care connections. And we had over 375 small businesses respond to that survey, and we'll be putting those results out pretty soon. But just to kind of give you a sneak peek, they're tallying the results, but I jotted this down and didn't have it in time, Brendan, for the presentation. But when asked if childcare has been a barrier to recruiting new employees, 58% said yes. When asked if childcare has been a barrier to retaining employees, 63% said yes. And the last one I wanted to highlight is when asked what the primary barrier for your employees needing childcare is, 43% said the cost of childcare is not affordable and employees choose to stay home. So if anything you take away from the conversation today, we've got to bring childcare and businesses together if we're going to solve the problem, because they're connected. And we just haven't made that connection until the last year or so, in the sense of what's really needed to strengthen our economy and our workforce.
I totally agree with that. And I've been with the chamber for some time now, and I'm really glad that we're taking up these issues, and it is incredibly important to have the synergy between the community and businesses, and there's no doubt at its importance. And when we go around the state, meet with a lot of businesses, talk to a lot of folks, no matter what the topic of our conversation, whether it's transportation or economic development or taxes or whatever, when we mention childcare, that's when, regardless of the business, that's when people start saying, "Oh, no kidding!" And everybody's got a story, and that's why I'm really pleased to have the ability to work with you and represent Fogle and other leaders like you all throughout the state and trying to solve this problem, or at least do the best that we can. Okay, one more question, and I'm going to go back. I think this is tied to the question about stacking.
Okay.
And that is, to clarify, could a child care facility apply for the essential workers and the small business grants if the 25% threshold is met for each grant?
So so these are two separate grants. So if you are going to, and there will be likely some differences in the areas, because remember, on the essential workers, we're targeting those rural communities that have hospitals and the rural communities that have our direct congregate care locations for state employees, like our correctional facilities, long-term care facilities, et cetera. And so there might be some overlap in the locations, but there could also be some differences. So to apply for one, you're really committing to one or the other. I'm going to apply for the essential workers and commit to that 25%, or I'm going to apply for the small businesses and commit to the 25%, because I'm not quite sure I can meet the 25% on the small business or on the essential workers. So I'm not aware. I'll take this back to the team because, like I mentioned, we're still working on the requirements for the small businesses. The essential workers has pretty much been set and it's going out next week, but we can take a look at that language in the small businesses. But I believe it's defined as a new program. That means that you have not operated, you're not operating. It would have to be a separate facility or a separate program. That's the way it stands right now.
Okay. And one more thing before we let you go. You mentioned the essential workers grants and others that are targeting rural areas. I know that's been a real difficult subject for a number of folks throughout the state. What other strategies are you all employing to try to help those areas?
This kind of gets back to that recruitment and retention piece of this, and that livable wage that you had mentioned. And like you had said as well, we're all competing for workforce right now. And one of the things that I think that we need to really elevate is how important a child care staff member's job is. And, it is challenging, but it is the most rewarding job that you will have. The first time that you see a baby coo, the first time that you see a baby start to crawl or roll over, and know as a caregiver that you've had the involvement and the expertise to help support that child's development is huge. But that's the once in a while types of rewards that you get. It's really similar to being a parent. It's one of the most challenging jobs and the most rewarding jobs that you'll have. But we have to start thinking about how can we elevate the importance of our child care staff members. And we want to provide that through not only the grants that we mentioned, but another piece that you'll see in our ARPA funding is lots of professional development. Through the pandemic, we saw challenging behaviors in children increase, and our child care staff members are not sure how to deal with those, not sure that not able to use the strategies that we had before the pandemic don't really work now, because it's just a different type of behaviors and learning that we're seeing. So you'll see lots of professional development in there. And I think the last thing that I want to mention is many of our child care providers also qualify for child care subsidy themselves. And that's just not right, Brendan. We have to find a way to elevate child care providers in the sense that they make a livable wage and that they're making just as much as a retail store or a fast food restaurant or a gas station down the street. Because as you mentioned earlier, when they can go somewhere else and they can provide that workforce, elsewhere for a higher pay, for higher wages, we'll lose childcare staff members to other positions. And again, this isn't just childcare. There's other positions that historically have not been high wages. And all of those positions are starting to really take a look at what we're going to have to do to be competitive. Or those positions will be lost to other positions in that community.
Well said, and I couldn't agree more. And so thank you so much, Dr. Thomas, for participating in this webinar. Thank you all for those who are on the webinar, and hope you've can take something from this. And on behalf of the Chamber, we want to thank you, Dr. Thomas, and your staff and your team, and Representative Fogle and the other legislators working on these issues so much for doing so. And also would like to thank those of you who are on the webinar who are in the field. Thank you for doing what you're doing. We certainly appreciate it. It's an important, not only from a societal perspective of really helping kids grow and develop, but also from an economic development perspective. So thank you all very much. We will be sharing these slides, and we will also be sending out a recording next week, likely. So again, thanks for joining us, and hope you have a wonderful weekend.